Welcome to Authentic Moments with Kiva. I am joined today with 3 of Cone Health's pharmacists, and we are going to explore and talk about the COVID-19 vaccine. So we know that COVID-19 has been devastating to our country and to our community. And we are really, really hopeful and excited that we have a vaccine that can help us with the transmission of this disease. But there are a lot of people that are a little bit skeptical. And so we wanted to get together and spend time with you all just to talk a little bit more about the vaccine and dispel any myths that are out there about the vaccine. And so we thought there's no better way to do that with 3 of Cone Health's finest pharmacists and the pharmacists that happen to be people of color. So I'm going to start just by asking you all just to introduce yourselves and tell me just how long you've been with Cone Health.
Hi, I'm Courtney Isom. I work at the Community Health and Wellness Center as a pharmacy operations coordinator, and I have been here for 6 years.
My name is Harvin. I'm the director of pharmacy for our Cancer Center service line. I've actually been here for 1 year.
And I'm Elvira Madueme. I am the assistant director of operations at the Wesley Long Pharmacy, and I've been here for 17 years.
So I have to ask, when you first heard that there was a COVID-19 vaccine being developed, what came to your mind? What was the first thing you said or thought about that vaccine being developed?
I thought that it was great. For me, I looked at it as this is what we can accomplish in terms of like the medical field when you have everybody rowing in the same direction. So to hear that every biopharmaceutical company potentially across the globe was trying to develop one of these, that was kind of a no-brainer. The fact that they were able to get it done so quickly was just very impressive. It was kind of like a breath of fresh air that we've got a real tool here to combat this virus, and it's something that was just very exciting for me.
So I do have one question about that. So one of the things that has come up in discussion in communities is really that how in the world can we create a vaccine in 9 months? Something's got to be wrong with it. Something's not tested. How could this be?
I mean, I know that it was kind of some things that were done ahead of time. If you know, for instance, there was SARS, back in the early 2000s. So, all that stuff has kind of, come together now. So they were able to look in and see how they can actually develop it a little bit faster. And we have, better technology now. We didn't have that technology back then that we have now. So, I think that it was a culmination of, the old stuff, being brought in with the new technology that we do have now.
So the type of vaccine this is called an mRNA vaccine. And what mRNA does is once it's injected through the vaccine, it actually teaches your body how to create the effective antibodies that will recognize that COVID virus when it invades your system. It'll prevent it from, proliferating and making you sick and then making you infectious to other people. And so that type of vaccine has actually been developed and researched since the late 1990s.
So I have to ask you all, have you all taken the vaccine yet?
I have.
Yes, I have.
So you all have taken the vaccine.
Mm-hmm.
Right, so we gotta dig into that. So tell me a little bit about taking the vaccine. Have you taken both doses or just one?
I've taken just the first, yeah.
Yeah.
Okay.
Yeah, the doses are spaced about 3 weeks apart.
Okay.
So I'm actually due for my second shot next week.
So tell me about it. Did it hurt more than any other shot that you got? And tell me a little bit about the side effects, if any, that you had.
Sure. So it felt very much like getting a routine vaccine. I was actually expecting, I think, just because of the nature of this vaccine, I was anticipating maybe I'd feel it a little bit more or something, but not at all. It was a very painless stick. They do make sure that they keep you around for 10, 15 minutes to make sure that you don't have any adverse events or any side effects. Typical soreness, muscle aches is common, but I have not experienced anything outside of that. So it was a very mild response to the vaccine.
The minority population or the Black, Hispanic population, we know that they've been hit harder, right? We've been hit harder with cases of COVID-19. And so with that, it becomes, hey, let's think about the population, right? Let's think about Latinx and African Americans, and let's say, hey, well, we want to make sure that there's equity as it relates to getting this vaccine. So do you all know anything about how that's being approached as far as to who gets the vaccine first? I mean, we know that clinicians and hospitals and nursing homes, you know, there's phases of it, but do you know anything about how we would prioritize the administering of the vaccine?
So I know that they just kind of updated the guidelines from the state. So it was kind of mentioned also, I think, in the leader meeting this morning as well. But so they're doing it 1B, group 2. Now they have 3 groups. So group 2 would be healthcare frontline essential workers who are 50 or older. And then group 3 would be frontline workers and healthcare workers of any age. So I feel like that would include a lot of those from the, you know, Latinx and African American community, because they are those essential workers that we see a lot of times.
Yeah, what's really good about the way North Carolina is handling it is that anybody can actually see it on their website. So if they go to the North Carolina DHHS website, the first thing that's going to pop up is COVID, and they actually have like the full updated guidelines there. And as Courtney said, they seem to update very often. The way that North Carolina is rolling out, it's not specifically targeting demographics along a racial timeline, but really looking at it in terms of age. So we know that person greater than 75, if they get infected with COVID, they have really bad outcomes. We know that certain disease states, whether it be cancer, diabetes, hypertension, some of those like really bad comorbidities, they're going to have a higher incidence of poor outcomes with COVID.
You know, in the Black and brown communities, there is a reason that there is mistrust out there, right? So there's mistrust out there as it relates to healthcare, as it relates to just social justice in any form, right? But when we think about healthcare, we know that our history hasn't been as kind to us, right? And so we know that. So I want to talk a little bit about some of the myths that are out there and just try to help talk about what they are and how we can help dispel some of them. Specifically, the Tuskegee Experiment. I hear a lot of people talk about, oh, is this another Tuskegee, incident?
Yeah, and I'll say it's tough because a lot of times when we think about racial disparities, specifically Tuskegee, it wasn't that long ago, right? And that's what's hard. And one of the great things that I've heard about is they said, when someone cuts you and it cuts deep, and that cut is not taken care of, it festers and it becomes a scar. We all have a scar somewhere in our body that 20, 30, 40 years later, someone will say, well, how'd you get that? You remember every detail about it. You remember how you felt at that time. And most of all, you'll say, yeah, I won't do that again, whatever it may be. I have a pretty big scar on my hand, and I'll say, I'll never try to open a Tuna can without a can opener ever again in my life, because I have this pretty big scar on my hand. So that's really where we are. A lot of people say, get past it. This is different times. But a lot of the people that were involved in this Tuskegee experiment are still alive. And so it's one of those things that is sometimes difficult to get past. And we have to, I think, see it head on that was a shameful period in our history, specifically when it comes to disparities that were not necessarily created, but observed in the medical community, where they could have, made an intervention and gave those men and women treatment that would have prevented some of the outcomes that we saw during that experiment. And that's something that we have to be able to kind of categorize and say that since then we have evolved more as a society. There were things that were acceptable at that time that aren't acceptable anymore. We have to also understand that, to your point, this is the only thing that helps us get on equal playing field when it comes to how this virus specifically is impacting our communities. And so make those decisions based on fact, right? Don't make it based on what someone told you. You've got a lot of people within the medical community that can help you make that decision and can help you come from a space of, ensuring that you're doing the best thing for you, your family, and your community.
Diversity in all fields in healthcare is extremely important. And so making sure that you've got representation from all aspects of our community, making sure that you have Black and Brown doctors and scientists who are right there, who are performing the tests and who are bringing their own perspectives and insights into these investigations is extremely important.
The last question that I have is, and you all have said so much and have given us so, the dialogue has been rich around the vaccine, and you all have taken the vaccine and the side effects and trying to make sure that we're educating and helping people stay with the facts. So if you had one last thing to say to the communities, our employees, or any other population about taking this vaccine, if you could just put it into maybe one or two sentences around why you did it and how you can encourage someone else to take the vaccine.
So I think the reason I mainly did it was just being a, spokesperson for my family, or trusted voice for my family. They trust me already as a pharmacist. So I feel like, they see me getting this vaccine, no side effects occur, then, they're going to trust to go get it. I mean, I know in the past when there's been, flu vaccine, some people in my family don't get the flu vaccine, but I finally convinced them, hey, this is why this is important. I think it's just more so about, educating people, gaining their trust. I mean, that's what we're, trained to do as clinicians is to gain that trust. And I like how Dr. Kizzy Corbett kind of explained it when she was talking about the vaccine, about the mistrust has been, as we talked about, the mistrust with the, Tuskegee experiments. But we have to gain that trust back. And I like how she said we have to do it on a brick by brick approach. So we have to, continue to build upon those blocks and, continue to teach our community, continue to teach our patients that we are listening, we are there for them. And like our mission says, we are going to be right here with you.
So for me, I'm a data and science kind of driven person. And so for me, it was follow the data, follow the facts, and make the best decision. And for me, it was, I was a person that looked at the studies, was brought into helping with representation around this very early on, and wanted to make sure that if I were going to sit down, and we talked about this before we started recording, with my mother and convince her to take the vaccine, that I knew all the data and the facts, because I was going to be telling her, hey, trust me and take this vaccine.
I understand that the general community may have a harder time grasping the severity of this. You don't see the disease. You're walking around, everyone looks healthy. Why are stores closed? Why can't I do what I've always been able to do? I understand that perspective. I have the benefit of working in a hospital that takes care of these patients, and I've seen patients die of this disease. And so the reality is so much more real to me, that it's important that I'm able to share that perspective to my family and to those that I come in contact to, because I understand that you just don't see it. And if you don't see it, it's kind of hard to really grasp how bad this situation is. Listen to the other perspective. So if you are a diehard anti-vaccine, open yourself and allow maybe someone else from a different perspective to share their knowledge, and really open yourself to understanding the other side.
Thank you. Thank you. Well said. And I just want to let you all know that I am excited or when it's my turn to take the vaccine. When I think about all of that you've said today, and when we think about, it's about building trust, it's about getting the facts, it's about being respectful and listening to other points of views. I mean, all of that is a part of who we are at Cone Health, right? And so I am just proud that we work for an organization that encourages us to have to engage and embrace in diverse ideas and diverse thoughts. And also that to make the space for us to have conversations about whatever we want to have them about, and so that we can really, really help educate and feed that curious mind that we know is out there. We appreciate you and thank you for all that you're doing and for how you're serving our community and our patients and how you're there for each other.